Topic is going to be the comparison between Canadian and the United States treatment strategies. And here's just this is my topic and what I'm going to be presenting. So, the main topic within the treatment, kind of like what's going to be talked about, is that there's many different types of addictions throughout the whole world, and many different worldwide problems within the addiction, but I'm going to be focusing on opioid addiction as we learn that throughout this whole course and semester and how it can be treated. Specifically, looking at two countries, the country of Canada and the United States. And what I mean by treatment strategies is that many can suffer from addiction and they need help to maintain a normal life without relying on addiction constantly. And in order to get that to not get that constant reliance, they need to seek treatment, whether that be rehab, medicine, therapy, and these are kind of like what I am focusing on. And right here is just a figure that says the three waves of the rise in opioid overdose deaths, which can show that if you don't seek strategies to help with your addiction, that it can lead to overdoses as a more cheaper and affordable way to get that same high in opioids is heroin, which is also a very harmful disease. And these are all just throughout the years of 1999 and 2018, you just see it skyrocket and just take a whole other toll in the world. And it is a problematic pandemic that needs to be addressed. And in this slide, we are comparing Canadian and the United States of the OAT kind of therapy, which is the opioid agonist therapy policies. And the access to use OAT is actually really low in both countries, which so it makes it very hard for them to actually seek that help. And a lot of health insurances don't take OAT, so it is hard for people to get the money to pay for that, as in Oregon and other states within the United States don't take a fully coverage of OAT. And there's only about 5 options of OAT available in Oregon, which does make it fairly hard for people to seek that therapy for opioids. And in this diagram, we are looking at not the deaths this time, but the crime over the 6 months when using OAT. So it's kind of showing that what it looks like when you're on normal opioids, kind of what your crime rate is, and then showing the results of you on doing OAT, and shows that it is helpful and it could be a solution, but it does need to be more accessible if it is a solution. And these are the strategies against opioid crisis that the United States and Canada both are kind of acknowledging and both kind of sharing with each other on how to find a solution. And I just took direct quotes from this since I didn't want to really paraphrase it, as they were pretty good quotes. And the capacity to address pain and substance use disorders can be increased through online mentoring programs such as Project Echo, which is talking about that there is a large amount of people that are addressing the problem, that are trying to do online things such as like Zoom therapy, especially now with the pandemic going on in the world. They're trying to find more solutions within that to see if it is a good solution, that maybe if someone doesn't want to be in person, since it's a little intimidating, they can be online and kind of, let out what's going on. And also, the police in Canada and the United States carry Naloxone, a harm reduction measure can provide connections to treatment services, which is talking about how the police in both Canada and United States carry this Naloxone as to reduce the harm going on, and it can provide connections between these treatments. So it's saying that it can help reduce the problem, but also open range into what can be a solution to this problem. And this medication can address these symptoms but it will not improve entirely 100%. So these medicines will help with the addiction, but it's not 100% solution, as you shouldn't rely on other medication to help with your opioid addiction as it is other form of medicine. And then this figure 3, we have deaths and ortanio prescribed, diverted, or elicited. So you see different kind of statistics within. So we have one in males, we have one in females, and then we have some in ages. They're kind of all throughout, spanning out in different years, different statistics, different percentages on what needs to be fixed within opioids, kind of saying that there's 1 in 3 opioid related deaths occurring among people with active opioid prescriptions, saying that maybe we need to be more careful about who we're prescribing opioids to, because anyone that takes on, it's like rolling a dice and you can get addicted, as it's a very strong drug. It does help your pain, but it can or will start an addiction without even knowing it. And here I just have more figures to show you and that are about opioids, and the first one, figure 4, is going to be the pie chart, and it's going to show the different types of opioid use within 42 months. So in the blue figure is abstinence from opioids and not on OAT. So it's just showing that they're just taking off opioids, but they're not really seeking help for it. That's most of the percentages of people kind of route that they're going to. And then the red is showing that the people that are taking OAT but are not taking any other opioids, not seeking any other medicines, just going through therapy, just fixing their mentality. And then the green is showing that they're taking more of the medicine route and the OAT route, that they're kind of taking one and one physically and mentally. And the purple is showing that they're using opioids and not seeking any help whatsoever. And the other chart is going to be a line chart and has different colors. And for the blue, it's going to be the current opioid dependence. So this is going to be the measure of people throughout months that are still dependent on opioids today. And then the red is going to be the measurement of percentages of absence of illicit opioids. So this is people that are staying away from those opioids that they once were addicted to. And then, and these are through mostly like clinical opioids that were prescribed to them, not really like taking on heroin or anything. And the green is going to show the percentages of people that have been prescribed these opioids, seeking the OAT treatment and going through therapy for that. And the last reference I have is going to be lessons learned from opioid crisis against the pillars of the Canadian drugs and substance strategy. So this is more going to be around the country Canada and kind of the information they gathered while going through this problem of opioids and many citizens facing this problem. And it says that Canada has, or these are paraphrases from what the reference I've gathered, Canada is being challenged in how it's able to fix this opioid epidemic, and as more and more people are dying. So they are being challenged with what is the correct solution. It's kind of trial and error as more and more of their citizens are dying and they want to stop that death rate. A wide range of help is to find an effective and accessible pharmaceutical and psychological treatments are still required in order to find a solution to the epidemic. So they're still struggling whether to find how to find a really good solution for pharmaceutical people so they're not in trouble for prescribing opioids for chronic pain, and also a mental psychological treatment such as the OAT therapy, but making it more accessible to their people, and how to solve that problem, as one goes hand in hand. You can't just fix one without the other. And also saying that just because you have an addiction doesn't mean that's the only problem you have. It could talk about your economic problems, as most of your money goes into that drug. It can lead you to homelessness. Your family could leave you, and you just lose your education as your brain just declines and everything. And they just have to they're just struggling with come up with two of those strategies of saying what's going to give that person the right kind of relief of that chronic pain that actually do need the medicine, that's not going to be so harmful to their body and make them addicted, but it's got to give them that same relief that, hey, I have really bad chronic pain, but I do need medicine for this and I won't get addicted. And the second focuses on what is going to give these opioids prescription, what's going to give these doctors a more reason that they won't feel their patients got to get addicted. What can they do to help their patients? And then in this other figure, I have just different things that are going to go into opioid addictions that also go along your mental health, showing that it's not just the addiction harming you. It can harm you physically, emotionally, mentally, and different things such as anxiety, depression. You can end up with schizophrenia, ADHD, PSD. You can just fall into alcoholism as you're trying to get that same feeling of relief and calmness. And you can get bipolar disorder. So it's not just the addiction that you're struggling with. It can struggle with your mental health too. And these are my references that I've gathered throughout this project. Thank you.